I'd like to bring in two participants in the trial, Nicholas and his mother, Dr. Kelly Gibo. Dr. Gibo, what part of the trial are you in?
I'm in the prevention arm.
What is your status? What happened?
Our son Nicholas, who's been living with us, was tested positive, so he was considered as a infected participant, and my husband and the rest of our family were considered exposed. So we enrolled in the prevention part of the trial.
Right. So you're the part where you've been exposed. You haven't been positive yet, correct? Nicholas, you got infected. Do you remember where or how you got infected?
I don't remember explicitly, just because of the nature of the disease. You don't really know where you get it or where you're exposed. But I have been working at Johns Hopkins during this pandemic, working with COVID patients as a critical care transport EMT. So I think it could have been an occupational exposure.
Sure. And then you had symptoms. Can you talk about some of the symptoms you had?
Yeah, so thankfully I was very lucky, and I had very minor symptoms with, headache, body ache. I had a pretty upset stomach and, some diarrhea too. But other than that, I had really just no respiratory symptoms, which was honestly a blessing.
Dr. Gibo, talk to me about the actual logistics. What happens when you join the trial? Take me through that.
Well, it was really easy. We were able to get in contact with Dr. Shoham and Dr. Sullivan for Nicholas. We were able to do the consent within one day, and we actually were tested. We had some blood and a nasal swab to confirm that we were negative. So my husband and I both did it. And then the next day went in for an IV, received our infusion. It took about an hour. I honestly was able to do my email and conduct business while I was having it done. And you have to wait about a half hour afterwards to have your vital signs taken and make sure you don't have an allergic reaction. And then we were done. And we've gone in for 2 follow-up visits after that to have blood samples taken and a nasal swab. But it's been very easy.
Very easy. Now, as a mom, as Nicholas's mom, to hear that he was positive and you both being in the healthcare space, that still had to produce some level of anxiety.
Well, as an infectious disease doctor, Nicholas has been hearing a lot about the conversations we've had in our house about how it is, COVID and trying to be careful. So we had really been very careful, trying not to go out to restaurants. We haven't traveled. Nicholas has been living with us instead of being in college. And our real only exposures have been back and forth really through work. But yes, it was a little anxiety provoking. And, we were able to clean the house and keep Nicholas separate from the rest of us. And thankfully, we all have done well. He's recovered quite nicely, and we're very grateful for that.
Yeah, Nicholas, how are you feeling?
I'm feeling much better. Honestly, my symptoms resolved very quickly, and quickly after I received the plasma, and I'm feeling much better and almost back to normal now.
Awesome. Love to hear that.